Hello, my name's Simon Williams and I'm a consultant obstetrician working in Newcastle hospitals. Today we're going to be discussing an important topic, pre-eclampsia, its risks and the role of low-dose aspirin in managing these risks during pregnancy. Pre-eclampsia is a condition that causes high blood pressure in pregnancy, and it can affect other organs and systems like the liver, the kidneys and the blood clotting system. It's a serious condition for both mother and baby. In most cases, pre-eclampsia is mild. However, it can lead to premature birth and the baby being small due to not getting enough nutrients through the placenta. In severe cases, pre-eclampsia can cause seizures, also known as fits, and very rarely it can even lead to death. Pre-eclampsia usually happens after 20 weeks of pregnancy, and sometimes it can happen after the birth of the baby. Some people have risk factors that mean they're more likely to develop pre-eclampsia, and we know that when somebody has risk factors for pre-eclampsia, taking low-dose aspirin regularly throughout the pregnancy can reduce the risk of pre-eclampsia happening. We advise 150 milligrams of aspirin to be taken before bedtime from 12 weeks to 36 weeks of pregnancy if you have any of the following risk factors: a history of high blood pressure during a previous pregnancy, high blood pressure outside of pregnancy, type 1 or type 2 diabetes, chronic kidney disease, and certain autoimmune diseases. We also recommend taking aspirin in pregnancy if 2 or more of the following risk factors apply to you: if you are having your first baby, if you are 40 years old or older, if you have had a gap of over 10 years since your last pregnancy, if you have a body mass index of 35 or higher at the start of the pregnancy, if you're pregnant with twins or more, or if you have a family history of pre-eclampsia in a first-degree relative. Low-dose aspirin works by supporting important processes during the development of your baby's placenta. It can also help prevent blood from clotting and reduces inflammation. If taken as prescribed, aspirin can reduce the risk of early onset pre-eclampsia by about 60%. However, taking aspirin as prescribed does not guarantee that you will not develop pre-eclampsia. Therefore, it's also important to know the signs and symptoms of pre-eclampsia and to seek help if you experience them. We'll tell you more about the signs and symptoms of pre-eclampsia in the following sections of the programme. Although low-dose aspirin is proven to be safe for use in pregnancy for both mother and baby, we have learned that pregnant women and people who take low-dose aspirin may experience more bleeding complications during their pregnancies. Serious bleeding complications are rare, and generally the benefit of taking aspirin is greater than the risk of these complications. People who take low-dose aspirin may be more likely to experience spotting during pregnancy. While spotting in the second and third trimesters is unlikely to be linked to pregnancy loss, it always needs to be assessed by your local maternity assessment unit. People who take low-dose aspirin may be slightly more likely to have heavy bleeding during or after birth. If this happens, healthcare professionals will offer treatments to manage the bleeding. Lastly, there is some evidence that people who take low-dose aspirin are very slightly more likely to suffer from placental abruption, which is a premature separation of the placenta from the womb. This is not common, but requires immediate medical attention if it does happen. To reduce the likelihood of these complications, we advise that you stop taking aspirin at 36 weeks of pregnancy. Not all pregnant women and people will be able to take aspirin. People with the following conditions should not take aspirin: if you have an active stomach ulcer, if you have certain bleeding disorders, if you have an allergy to aspirin, if you have severe asthma, or if you are under 16 years of age. Unfortunately, if you're not able to take aspirin in pregnancy, there is no alternative medication that we can offer. Your midwife will monitor your blood pressure and urine regularly to spot early signs of pre-eclampsia throughout your pregnancy. Please discuss any concerns about the use of aspirin with a member of your healthcare team and inform them if you decide not to take aspirin or if you stop taking it. It's your decision, but it's important for your healthcare team to know. Remember, we're here to help.